It's the 7-Minute Drill, a fast-paced and fun conversation about common orthopedic topics and solutions with Dr. John Urse. Brought to you by
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. You can find Ted's in Dayton, Ohio at Dots Markets. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted.
We would also like to thank
Stifel's GWR Group combines more than 65 years of experience helping high net worth clients consolidate, coordinate, and simplify their wealth planning strategies. The group has access to a full suite of resources to serve all of your financial needs. Email gwrgroup@stifel.com or call 937-353-2863 to speak to Guy, Brad, or Jeff Richardson. Stifel, Nicholas & Company, Incorporated.
All right, Dr. John Urse, we just did a podcast a few minutes ago on shoulders popping out. By the way, this is a 7-minute drill with Dr. John Urse, and we are here today to talk about something popping again. What's popping?
Well, today, Terry, we're going to talk about why is my kneecap popping out?
Why? Well, why is my kneecap popping out?
Well, because it sits in a little shallow groove in front of your knee, and if it doesn't stay there, it jumps the track and pops out.
So you brought a visual aid to kind of share with this.
I did. So remember, our knees just bend and straighten, right? But in the very front of the knee is a kneecap, and that's this little 50-cent piece. And if we
Is it about a 50-cent piece size?
Yeah, it's about the size of a 50-cent piece, maybe $1. But it sits in a groove. So much like two spoons sitting in a drawer, if they're stacked right, they are happy and they don't scratch your silver, right?
Okay.
But if they are sitting, sideways or not next to each other, they're not stacked. And if the kneecap isn't in place, it can make the knee feel, first of all, very painful, but it also may lock the knee from straightening all the way or further bending, because now you've got part of the kneecap out here instead of in the front where it's supposed to be. So we need our kneecap for a couple reasons. It protects the knee. Like sometimes you get hit in the front of the knee. You might break the kneecap, at least it protected the knee. So sometimes it literally gets broken like any other bone. But it also, some more important thing is it helps straighten our knee. So the muscles in the thigh, we talked about our quad muscles, there's 4 of them. They attach together like 4 horses on a chariot to lift the knee and help straighten it. So those muscles, if they're not balanced well, the kneecap can tilt and it can rub. That can just be treated with muscle strengthening or what's called taping. But if it starts to jump out of the track or it stops
jump out of the track, is it going left or right?
It usually goes to the little toe side. So most kneecaps all go to the outside.
Yeah.
And you'll see this, if a true kneecap dislocation is in place, you'll see like a big bump on the outside of your leg that's stuck. And, if you don't know how to put it back in, if you go to an emergency room or an urgent care, the doctor will probably give you a little la-la medicine, and they'll put their thumb in there and push the kneecap over toward the big toe side, right? It's on the outside. If something's bent to the left, in orthopedics, we bend it to the right. So we figured this stuff out pretty quickly in school. But once they push it over, it'll jump back in the track. We'll put it in a knee immobilizer, the things that hold the knee straight. You get them in the emergency room, and you walk around. Another old reference, Chester on Gunsmoke walked with a stiff leg. So if you walk around with a knee immobilizer for about 3 weeks and let that heal, sometimes the kneecap will stop jumping out of place. But there are things that hold it in place. There are little ropey things. We talked about ligaments. Ankle sprains have ligaments that hold the ankle together. There's a mercifully abbreviated ligament. It's called the MPFL, so you can imagine how long that ligament name is. But if that ligament on the inside of the knee is torn, it doesn't hold the kneecap in place. So you may not know that unless you do an MRI test later, and we'll talk a little bit about how do we diagnose the reason your kneecap's not staying in place.
So does it make a noise when it pops?
It can, absolutely, because it's jumping the track. We talked about it leaving this groove.
So you hear it pop like an ACL kind of thing?
You might. Most pops, if you hear a pop in a knee, 75% of the time it's an ACL injury.
Really?
It can be, yeah. So that's 2 really important questions on knee injuries. Did it swell right away? Did you hear a pop? So A kneecap dislocation can cause both also. But, you don't always know. Sometimes your guy tackling you hears the pop, but we'll usually ask, did anybody hear a pop or did you around your knee injury? And then, could you continue to play? That's a great question. It's like, oh, yeah, I played 4 more basketball games. Wasn't a very bad injury. If they say, oh, they carted, your kid off the field, lady, then, it could have been something, right? Might not be anything, but usually when they stop playing, our ears perk up a little more in the sports medicine world.
So what's the most common cause of this?
Well, believe it or not, it's most common cause is being a woman. So
What?
Females have wider pelvic bones to have babies. Therefore, their angle they come down to the knee is a little more knock-kneed. And so when your angle of your knee is more turned in, it kind of skews the kneecap to jump to the side. So we have to build muscles up to pull it in and stretch the muscles on the outside that would help it stay in. And there's a lot of those are physiotherapy or physical therapy modalities. The other thing is this groove is in a certain place, and if you're born with what's called a high riding kneecap, your kneecap is now above the groove, and it isn't really going to stay.
How would I know I have a high riding kneecap?
Well, an X-ray would show it.
But what if I'm just sitting at home listening to this podcast? Going,
well, unless you're really good with feeling, you wouldn't know that. But if your kneecap's been popping out, your first side view X-ray would show this kneecap, instead of being an equal distance to the bone, it's higher up, and that's called patella alta to our Spanish-speaking folks, and it just means high kneecap. So the patella is the kneecap, and if it's high riding, it's not in its groove. Other people are born with what's called a shallow groove. So instead of having a deep groove to hold the kneecap, it just doesn't have a bumper, like a bony bumper.
Right.
So it just jumps out. So in the treatment world, things we would look at will be based on response to treatment. Are you better with therapy and bracing? Sometimes they wear those little knee braces with a hole in the front, or they use the sports tape to hold the kneecap in. But if an MRI shows that MPFL ligament is torn, it's like a torn rubber band. It's not going back together. Then there are surgeries where they reconstruct that with a ropey graft to hold it like a horse rein. It just holds the kneecap in.
What is a graft? Is it a skin graft, a ligament graft, grabbing something else?
It's usually a tendon, which is a ropey structure.
Yeah.
And it can be from the person or a cadaver.
Okay.
So those are 2 types of grafts. Same thing when we talked about ACL injuries. We can take part of your normal anatomy and rob Peter to pay Paul, or we can take it from a cadaver. They freeze dry it, irradiate it, kind of like sushi, so it kills all the bugs.
Yeah.
And then you weave it through where the old ligament was. If you have a shallow groove, we talked about that's why the kneecap's jumping out. Well, then you might have to build this trochlea, which is the groove for the kneecap. You may have to make a bigger bumper with a bone graft. That's not very common. But the more common thing we do is we move the attachment of the kneecap over so it's lined up better, and that's called a tubercle transfer. So the kneecap,
Can we point it that way? Yeah.
the kneecap actually sits and attaches to the shin bone, and by moving, it's like taking a dog by the tail. You're cutting a little piece of bone, but moving it over to make the knee less knock-kneed, which then aligns the kneecap in the groove better. And that's a very good surgery when the person's very knock-kneed. They call that a Q angle, which just measures the angle from the hips to the knee. And when you're very knock-kneed where your knees touch, that lends to a bigger risk of kneecap problems and what are called dislocations or partway dislocations.
Let me ask just a side question, because you got me curious. You're opening somebody up to do one of those grafts, right? Is that like a thread size? Is that like a?
It's about 1/3 of an inch, maybe about the width of a pencil, but it's a rope, right? So
that's in my knee right now.
It
That's
will
something
be,
that
yeah.
size.
So it has, what you do is you put stitches through the end of it, and you take those little anchors we talked about on the labrum repairs, or a rotator cuff repair is tacked down to lift your arm when you tear it. So we anchor it into the kneecap. We drill a hole in the bone. That's why you're asleep for the surgery. And then we anchor the sutures into the bone, of the kneecap and then into the thigh bone, which is the femur, where that ligament would normally run. So by putting, it's called an internal brace, it runs from the bone of the thigh to the kneecap, and it's like a hard stop, I guess. And it has to be positioned perfectly with X-ray, and you want to have a sports medicine doctor who does these procedures if you're going to have that done. But that's if the MPFL ligament is torn. You'll see that on an MRI, and it may be all you have to do is fix that if your angle isn't crooked. So the doctor who's treating you should say, hey, your kneecap's popping out because of A, you're loose jointed, B, your knock-kneed or Q angle's high because your pelvis is wide, C, you have a shallow groove or a high riding patella. When we do that detachment down here, we can actually move down to bring the kneecap down into the groove by lowering the attachment. We then fix the patella alta by moving the attachment. So there's some pretty good ways to stabilize the knee. I probably have 30, mostly girls, who have had it done on both knees, because once you fix their kneecap from popping out, they're like, hey, I know it's a surgery, but do that on my other knee.
Really? So,
and it works because it fixes the problem. And that's what we do in medicine. We try to find what your problem is, address it, and find out from our literature and our own experience, does that solve the problem? If it does, we keep doing it, right?
The shoulder one we just did, you said if it pops out, you can kind of pop it back into place, and it's going to happen again and again. Now, is that the situation here?
Yeah, very likely it's going to keep popping out because the structures are now injured. Again, we're not talking about a deep socket like the hip. Hips rarely ever pop out of place. In fact, the few that do are usually from joint replacement surgeries where somebody's fallen or stretched out the lining, or they've got the leg contorted in a fall off a pickup truck. So these are shallow joints. They're happy when they're lined up. The shoulder's good when you climb trees if it's not over mobile, and a kneecap's much the same. It has to rely on the muscles, the ligaments to hold it, but that allows flexibility of the knee to do the functions we use a knee for.
But every now and then when I'm on a walk, and I walk all the time, my knee will hurt.
Yeah, that isn't going to be the kneecap popping out.
Okay.
It could be the kneecap though, because remember we talked about the kneecap as two spoons in a drawer, and if your kneecap is tilted, you're scratching the silver. So you may have pain with squatting, stairs, inclines, and that's kneecap mechanics. We had a podcast called 5 Reasons the Front of My Knee Hurts, and 90% of those are fixable with therapy by strengthening the right muscles and lining the kneecap in the groove better,
right,
with the tape or with a brace or the physiotherapy.
Okay, what have I not asked during this podcast that maybe I should have?
I think you've hit most of the good salient points.
The good stuff.
I think if someone has a problem with their kneecap that isn't being resolved, I'd go see somebody and let them examine you, get the proper exam. Do
normal docs, general practitioners know about this? I mean, is this...
Sure. And they may help us a lot. They may order an MRI for us, or they may start you in therapy, which is, I mean, most healthcare providers, whether it's a chiropractor, a physician assistant, or we call them physician extenders, because there's nurse practitioners, PAs, there's all the APRNs, all the letters after names now. So anybody who sees you initially is going to say, rest it, quit doing what's making it worse, try something for inflammation, try a brace, try therapy, let's get a basic x-ray, and then maybe an imaging study. Now, some of the imaging studies sometimes need the specialist to order before the insurance approves them. But But if they have it, I never turn down the information when they come to me.
Sure.
And I go, hey, let me look at your MRI. It needs to be somewhat recent.
So just last question I have for you, again, is more doctor curious than anything else. You got the MRI. How long does it take you to stare at it and say, yep, I know what the problem is? Is it like a 30-second thing? Yeah, I got that. So this is easy.
Well, you're going to look at the MRI and say, is this MPFL torn? If it's not, is the kneecap in the groove? Yeah, it doesn't take us long because, I mean, I've been doing this for 38 years. So for me,
you look young.
But again, experience Will Rogers said experience is a name people use for their mistakes. So I'm getting pretty experienced at knees by now. But I mean, we see these commonly. This is a common problem. Kneecap problems are very common, certainly more common in either loose jointed people or women.
When do women notice this? Usually,
they'll notice it in their adolescent years.
Like 13 to...
Yeah, 13 on. Yeah. I mean, I think if you've got a knock-knee knee alignment, you're going to be a little more risk for kneecap problems.
Got it.
So I think it's a good topic. It's a very fixable topic, but it's frustrating for the patient when it isn't being controlled with therapy or braces, and then they should get more information from somebody.
All right. Well, hey, this has been a great episode, by the way. I love when you bring a show and tell item in. I mean, I can't wait for what's next on this.
Well, you can't really describe a haircut very well without just showing a picture or showing somebody, right? You can do it over the phone, but a picture helps.
It does. Hey, this has been the Bone and Joint Playbook, a 7-minute drill with Dr. John Urse.
Can I thank our sponsors?
I always forget to do that. I'm glad you bring that up.
Let's thank GWR Group, Stiefel, Nicholas, that's Guy, Brad, and Jeff Richardson.
Smart people, yeah.
And they do great financial planning for folks. Also, Ted's Salad Dressing is a great Greek dressing. You can look at tedsaladressing.com, and you can get it here in Ohio at Dots Market.
By the way, if you've never tried Ted's, try it because it's pretty cool. That comes from a restaurant in Dayton.
That's right. Ted had a restaurant, and he made this dressing because people asked him, "Hey, your dressing's great. You should market this."
Yeah.
So it's gluten-free, dairy-free, preservative-free. It's good for a marinade or for meats or for some fish or as a salad dressing.
We use it to dip bread in.
Yeah, it's great
Love
stuff.
that. Yes, because you go to those Italian restaurants and they have.
And don't forget to like the Bone and Joint Playbook on your social media site. Ask somebody else to take a listen. And as always, we thank Tri-Level Recording.
Hey, you're stealing all my stuff that I'm supposed to do. All right, folks, this has been the Bone and Joint Playbook. Thank you, Dr. John Urse. We'll see you all again real soon. Thanks.